the relation between sin and sickness? Well, like I said, my father was a doctor, and he said that 80% of the people that come into his office, he was a general practitioner, he could cure with aspirin and a good talk and send them home. Okay. That was 80%. So I said, well, what about the other 20%? And he said, well, those people are really sick. They need some drugs. They need some therapy. They need this, that, the other thing. Okay. So he was, and this is after like 40 years of medical practice. So he was one that saw psychosomatic illnesses all the time. Okay. And, even in the priesthood, somebody gets some kind of weird disease or something, the first point of attack is go and examine their personal life and see what sins they've fallen into. Because that should be the first line of attack. Because you got to get that out of the way to see if there is actually a physiological reason why they have a disease. Okay. Yeah. So most doctors I know, and I knew a lot of them because I used to hang around with them. I was going to be a doctor myself, like my father. And so I knew a lot of doctors, talked to them about these various things, and they all admit 50% or more of the diseases are psychosomatic. Okay. But then there are that portion that really are sick and need, intervention, physical intervention. Okay. So, yeah, most of them have admitted that. I don't know one doctor who has ever said anything different.